Hello. Today we'll be talking about medication safety. Medication safety. Safety is the process of administering drug correctly to get health benefits and to reduce harm. It's the process of using prescribed drugs or over-the-counter drug correctly to get health benefits and to avoid harm. So we'll be dealing with question 81 to 100 today. 81 to 100, all on medication safety. So question 1 says, before administering medication, the nurse should do what first? What should the nurse do? A. Check the medication order and patient identity. B. Give the medication immediately. C. Ask another patient to confirm the name. D. Document before giving. The answer is A. Before you give any drug, you must confirm the prescription or the doctor's order. Prescription or doctor's order is always on the patient's case note, their case file. So you check the case file to see the drug that is prescribed. Then you use that. To identify the patient. Use the case note to identify the patient. You can identify patients in different ways. You go to the patient, greet the patient, what's your name? You can ask the patient, or you call the patient by their name. And it's good to always check more than one identifiers. That's not just the patient's name, maybe the room number, etc. Because sometimes two patients can be bearing the same name in the ward. It used to happen. Two patients can be bearing the same name. So you need to ask using two different identifiers. So the first thing you do during medication administration is to check the prescription order or the doctor's order or the doctor's prescription and identify the patient. Question 2. What is one of the traditional rights of medication administration? There's what they call traditional rights, the 5 rights of medication administration, 5 rights. And the 5 rights are: 1, the right patients. Drug you are giving to must be for the right patients. It must be the right drug. If it's paracetamol, it should be paracetamol. If it's augmentin, it should be augmentin. It must be the right drug. It must be the right dosage. If it's in milligram, it must be in milligram. If it's in grams, it must be in gram. If it's in mils, it must be in mils. Right dose. Right route of administration. The right route, if it's by oral, give it through the mouth. If it's IM, muscle. If it's IV, vein. It must be the right route and it must be the right time. So those are the 5 rights or 5 traditional rights of medication administration. Right patients, right drug, right dose, right route of administration, and the right time. So question 82, the answer is A, right patients. Which one of the traditional rights? Right patients. 83, they say the safest way to identify a patient before medication administration is to use, I said it before, to use at least 2 patient identifiers. At least 2. Because more than 2 patients can be bearing the same name. They will bear the same surname, the same first name, the same middle name. So you need to use more than 2 identifiers to identify these patients before giving drug. Question 84. 84 say a medication order that is difficult to read should be what? Any medication order or prescription that is difficult to read, please take it back to the prescriber. Let the prescriber rewrite it in a way that you will understand. Let them rewrite it. Don't assume. Do not assume. When it is not clear, please take it back to the doctor or the physician that wrote it. Let them rewrite the drug. So your answer is B. Clarify with the prescriber before administration. The next question, 85. It says the abbreviation PO means medication is administered through where? PO. PO means per oral through the mouth. Per oral, through the mouth. It means you should give this medication through the mouth. Per oral. If they want it through the muscle, they will say IM, intramuscular. Through the vein, IV. Under the skin, subcutaneous. Number 86. 86 say the abbreviation IM means what? We said it just now. Intramuscular is IM. Intramuscular is IM. 87 say the preferred site for an injection depends primarily on what? That's the preferred site, per oral or IV or IM or subcutaneous, is dependent on what? Dependent on the medication you are giving, on the patient's factor, and the prescription route. So it actually solely depends on the patient and the types of drug that you want to give. Because there are some drugs that you must give through the mouth. And if this patient is not taking through the mouth and you don't have that drug maybe in IM or in IV form, you can actually prescribe something similar to that one that can be given in that particular route of administration. So it depends on the patient, on the medication, and the route of administration. 88 says, if a patient refuses a prescribed medication, what should the nurse do? If a patient should refuse a medication, what should you do? The answer is B. Respect these patients. When the patient refuses the drug, respect these patients. That's one of the ethics of nursing. Autonomy. Patient has autonomy. They have the right to reject drug. So just accept it. Assess the reason why. Document it and report it. Reporting is very important because you don't just document it that patient refused drug. Report to a senior nurse or the matron in charge of that ward. If you are the one in charge of that ward, you report to the doctor that prescribed the drug that this patient refused to take this drug. Don't force the patient to. Don't hide it inside their food. Don't discard it without documentation because some people may even write giving and then they will just leave the drug like that. Don't do that. If the patient says they are not taking, write the reason why they say they are not taking. If they don't have any reason, just write it that patient refused medication. Then report it to the appropriate authority. 89. After administering medication, the nurse should what? Is A. Once you administer medication, you must go back to check that patient for side effects or adverse effects. Side effects are their normal thing that most drug they makes this patient to pass through or make this patient to manifest their normal one. Adverse effects is worst. Normal side effects is okay. These ones are therapeutic effects. So you must go back depending on the route of administration. If it's IV, as you are giving the patient, you already see the effects. If it's IM, you can go back after 15 minutes to see if the injection is working or not. If it's per oral, at least 30 minutes later, you go and check for any side effects or any adverse effects. So after medication administration, the nurse must go back and check the patient, assess the patient for any side or adverse effects. Number 90, a medication error occurs when? Medication error. When does it occur? It occurs when you give drug incorrectly, contrary to how it was prescribed. Let's say they say give this drug IV. You now want to give IM. That's medication error. If they say give this patient per oral and you gave it IV, it's medication error. They say give this patient 500 milligram and you gave 1000 milligram, is medication error. Any error you do or any error that occurs as a result of administering drug to a patient is medication error. And you know they say medication safety is using drug correctly. So anything that is not done correctly while administering drug is medication error. So answer is A. Medication error means administering drug incorrectly. Incorrectly means you did not administer it based on the patient's prescription. Do you know that they can say one drug, like for example, they can say you want to give ceftriaxone to a patient. Patient A, they say give IV. Patient B, they say give IM. You can give the drug both IM or IV. But this patient, they said IM, and you went to give IV. Despite the fact that, yes, you can give it IV, that's the medication error, because on the patient's prescription, they didn't say IV, they said IM. So medication error is giving medication incorrectly. So your answer to this question is A. 91. When a medication error is discovered, your priority is to do what? Ensure patient safety, assess the patient, and you must report it. You must report the medication error in case of adverse effects, so they will know where to run to or to even prevent it from happening. So you must ensure patient safety and you must assess the patient. 92. If a patient develops a severe allergic reaction after medication, what should you do as a nurse? The patient develops a severe allergic reaction after medication, what should you do? The answer is A. You must assess this patient and initiate emergency measures according to protocol. According to protocol here means according to the hospital's protocol, because each hospital, they have their own different protocol on how to manage emergencies. So you must use your own hospital protocol. So you must assess this patient, then you bring initial emergency measures. There are always emergency measures for different drugs. So you should know the drug that you gave. And then if you know that drug, they will know the exact emergency measures to use based on the hospital protocol. So your answer is A. Number 93. Which action helps prevent falls in hospitalized patients? How do you prevent fall? Keep the call bell within reach. When I say call bell, I know okay, some hospitals in Nigeria actually have call bells. Mostly those ones that is room by room. That's they put patients in private rooms. Private rooms, they have call bells. So you put it in a way that it can be reached by the patient in case there's no relation. So the patient can easily press it when there's a problem or not. So keep the call bell. If you used to watch a broad frame, you see it. That's close to the patient bed. There will be a call bell. When the patient needs the nurse, the patient will just press it and it will alert the nurse wherever they are. So you must keep call bell within patient reach. Maintain safe environments. Maintain safe environments. If the patient is somebody that is bedridden or unconscious and the patient is on the bed, you should use a bed ray. They have bed rays that they use for children bed, so they have bed rays for children bed, that's pediatrics bed. They must use the bed ray to prevent the patients from falling. So you must keep the call bell within reach. The environment should be safe. There should be no water on the floor if it's tiled, and if the patient is unconscious, you can raise up the bed rays, etc. 94. 94 say proper body mechanism mainly help to do what? Prevent musculoskeletal injury. When they say proper body mechanism, for example, you want to give a patient IM injection and you want to give it on the gluteal muscle, that's the bum bum. When the patient is lying by the side, and you cannot reach that place very well, you may give it on the wrong side. But when the patient is positioned well, that's the proper body mechanism. Patient is positioned in a very straight way. You can easily see the bum bum or the gluteal muscle. You can divide it very well and know exactly where to put that injection. So proper body mechanism or proper body posture is very important to prevent musculoskeletal injury during drug administration. 95. Before transferring a patient from bed to wheelchair, the nurse should do what? Before transferring a patient from bed to wheelchair, you must lock the wheelchair brake. Very important. No wheelchair, they have brakes. It's close to where the patient will put their leg. So there's a way you move it down with your own leg. You just use your leg to push it down. When you push it down, the wheelchair will stand. It will not move. No matter how you push, it will not move. It will stay like that. So that's what they are saying, lock the wheelchair brakes. They have brake. Once the patient is on it, you use your leg to raise it up again, and the thing will now move freely. So you must lock that brake when you want to transfer a patient from the bed to the wheelchair. Even when you want to transfer the patient from the wheelchair back to the bed, you must lock that brake. If you don't lock that brake, the wheelchair will be moving, and you don't want that because patients may fall. So you must lock the wheelchair brake when you are transferring patients from bed to wheelchair or wheelchair to bed. 96. Which measure helps prevent pressure injuries? Pressure injuries. Pressure sore. How do you prevent it? A says regular positioning and skin assessment. B says vigorous massage. You don't do vigorous massage. C says keep the patient in one position. You don't keep patient in one position. D says restricting all fluid. You don't restrict fluid. So the answer is A. Repositioning. And when you want to change patient's position, it's done within 2 to 3 hours. Standard is actually 2 hours. For babies, it can be 3 hours. But changing of position helps to reduce pressure sore or pressure ulcer. Then skin assessment. You must assess the skin for redness, etc. You may even be changing the person's position every 2 hours, and the patient's body may be red due to too much friction or due to the patient's weight. So to prevent pressure area, to prevent pressure sore, you must do regular repositioning of the patient every 2 hours or 2 to 3 hours, and you must assess the skin. Question 97. An incident report is primarily used to do what? Incident reports. A. It's used to document and to analyze any unusual effects according to institutional policy, like your medication error. Medication error, it must be an incident report concerning that. Just when they say incident is something that happened that is not supposed to happen. And you must document it. So that's incident report. Documentation analyzing of any events that was unusual. Medication error must be documented as incident reports according to institutional policy. So all those things are according to institutional policy, means according to the hospital policy. 98. Which action promotes safe medication storage? Safe medication storage. Which action promotes safe medication storage? You store medications. There are some medications that you can take from inside, you can store the rest. So depending on the different kinds of medication. So they said the action that promotes it is A. Store medications according to manufacturer and facility requirements. According to manufacturer and facility. When they say according to manufacturer, it means, for example, artesunate. Artesunate, the manufacturer says once you finish mixing this drug, you should use it within an hour. That's what the manufacturer said. So manufacturer may say, after mixing this drug, you can use it within 12 hours. Meaning, after 12 hours, you must discard this drug. It will no longer be effective. That's why they say according to the manufacturer. So whatever the manufacturer states on the drug or the prescription, the leaflets, that is what you will follow. They say mix this drug, use it within an hour. You will use it within an hour. That is how you promote safe medication storage. Safe medication storage. You don't just store drug and leave it there. If you store it and leave it there, it will pass its potential. It is the date or the time of its effectiveness. And if you're going to give patient that drug, it will no longer be effective. So you must practice safe medication storage. 99. A nurse should check the medication label against the medication order. A nurse should check the medication label against the medication order. Why? At appropriate points during preparation and administration. They are just asking you when should you check the medication label. The medication label, if it's a syrup or normal drug, they must write things on top by the body, or if there's nothing, because sometimes by the body there are not much information, but there's a leaflet inside that drug. So you must read or study that leaflet during preparation, even before preparation, and after preparation. So at appropriate points during preparation and administration, you must check the label or the leaflets to ensure it's the normal one that you are given. I'll see you Ceftriaxone as well as also as another example. There are some Ceftriaxone that comes with IM. They'll say IM only. Some comes like IV and IM. Some they'll say IV only. So you must read the label to know if it's IV only, if it's IM only, if it's IM stroke IV. That's why they say you must read medication label. The last question says the overall goal of patient safety practices to do what? A. Promote to prevent harm, promote safety, quality care, to get good health benefits, and to prevent harm. That's the reason why you give medication, and they say medication safety. Safety practices, the goal is to give your drug correctly, to gain or to get health benefits, and to prevent harm. So those are the questions on medication error. By God's grace, by tomorrow, we should be starting medical surgical nursing. We'll be talking on different systems and maybe 20 questions on each system. Later, we can expand it more. So follow me, subscribe to my YouTube channel for more videos. Thank you.